John Popovich here again for another episode of Doc and the D, interviews in front of the living wall. We're doing a little something different with these next few interviews. So we're highlighting much of the incredible innovation that has been done by Henry Ford Medical Group physicians and surgeons, as well as the activities that are being done here at Henry Ford Hospital. And I'm very happy to welcome Dr. Menon, who is the chairman of the Department of Urology and also the Institute Director of the Vattikuti Urology Institute, who invented and perfected a surgical procedure for prostate cancer using robotic technology. So Mani, thank you very much for coming here. How did you ever conceive of the idea of robotic prostatectomy?
Well, John, first of all, thank you. This is a privilege. John and I go back a long way, but for 20 years, you've been my friend and someone I've looked up to. And thank you for allowing me to talk. I mean, everything that has happened in my career that's good has come at Henry Ford, and you don't do that without a team. So I'd like to thank the Henry Ford team. Specifically, your question was, how did I come across that? Well, I married up, and I asked my wife, what should I do to do minimally invasive prostate cancer surgery? And she said, you've got to come up with a new technique. And the robot just happened to be around, and so that's briefly what happened.
What's been amazing is not only the development of robotic prostatectomy, but really the use of robotic and enhanced surgical approaches to extraordinary number of surgical procedures. Where do you see robotic surgery going here in the future?
You're right. I mean, you see it exactly the way that I do. I didn't see this as just something that prostate cancer patients could benefit from. I thought this was just a better way of doing surgery. This robot, and there will be other robots, is an extraordinary platform that allows good surgeons to become great surgeons and great surgeons to become superstars.
One other question is, what's new in prostate surgery?
The new thing about prostate surgery, the way that I see this is we treat the cancer, not the prostate. And this means there are ways in which we can save more nerves than we were ever able to by treating the whole prostate. And some of the work that you and I have talked about, now going on to about 9 months, shows that it's extremely safe and very, very good results. So the argument that prostate cancer should not be treated, by and large, is based on the side effects of treatment. This argument ignores the fact that 30,000 men died of prostate cancer last year. And the only way that you can prevent those deaths is by treating it early. We're worried about the side effects. If we can minimize the side effects, could we not change the treatment paradigm?
Mani, I want to thank you for the time and for your great work that you've done.
Thanks, John. It's been fun, and it's been a great place to spend the last 10 years.